doctors who were working in the hospital had to follow hospital protocols to give patients this horrifically toxic and ineffective drug called remdesivir that they must have known wasn't working and was actually killing patients. But if they stood up and said, no, this is unethical, I'm not going to do this, they're out, they're fired.
Right. So the reason the hospitals had these protocols is it was a Medicare protocol, and all hospitals take Medicare, and Medicare reimbursement really, it went way up if the patient got remdesivir. So it was a terrible drug. It was a lethal drug. It was a drug that wasn't approved to be used for lethal illnesses, but somehow was approved to be used for the, SARS-2, which had a very low mortality rate, especially it really had a zero mortality rate unless you had multiple comorbid conditions. So these are decisions that are happening to you and to your loved ones, and you don't even know. You don't even know. Your best shot at not letting the system hurt you is to have an advisor who's unbiased. You can't change the hospital system. You can't change the Medicare doctors, but you can work in those systems if you're intelligent, right? If I ever, God forbid, have to go to hospital one day, I will have the wherewithal to be sure that I am not mistreated the way I see patients being mistreated all the time. My heart breaks when I hear the stories of ways that doctors have intentionally or negligently and accidentally misled patients. Not all doctors, they're not necessarily trying to do the wrong thing, but the whole system is not set up to be centered around your best interest. So if there's some take-home messages here, one of them is you need a smart, independent, unbiased advisor. Everyone needs that. 100% of people hearing my voice need that. Another thing is start thinking about the fact that health care and health insurance are unrelated. They're unrelated. You may choose to have some kind of health insurance product as a financial safety net. You may choose not to, but it has nothing to do with your healthcare decisions. Your healthcare decisions have to be you and an advisor who you trust, who doesn't have other incentives other than your well-being. That's healthcare. And over here is health insurance as a financial safety net for you. Just separate those two in your mind.